How painful is it? Oh, buddy. If permanent teeth in 24 hours is legit, why isn't everybody doing it?
If it was that easy, everybody would be doing it.
Our bodies don't heal in 24 hours. Is this safe?
You have to respect the body. The body takes time to heal.
How often do dental implants fail?
That's a tough one.
We're both doctors at Nuvia, and today we're going to answer some of the top controversial questions that people ask online about the 24-hour process. You ready?
Yeah, let's do it.
All right. So first up, what does permanent teeth in 24 hours actually mean? Dr. Park, you want to take this one?
Sure. So what permanent teeth in 24 hours means that patient comes in for surgery, we'll remove the remaining teeth, we'll place 4, maybe 6 implants on top, bottom. Patient will then go home, sleep off the anesthesia, come back in next day, and we'll have their permanent teeth ready for them.
The process itself, I think, is really cool because, I mean, there's certain situations where a patient will come in on a Monday, have their initial visit with us as far as like measurements taken and, the design process started. We get to, take it to about 80% of the finish line. The surgery happens the next day. We use these records to like fine tune our design. And then from surgery to when the teeth are in their mouth, 24 hours. It is kind of pretty awesome.
I mean, it's pretty cool. I mean, the technology that we're using, the old school version, I can't believe this is still something that's being done. This is a conversion denture, same day smile.
Yeah.
And it's just crazy that this is still being done versus using the technology today to create something where we have, some of the strongest materials, zirconia, teeth, being able to provide that to the patient is amazing to be able to do it in 24 hours.
Totally. Sometimes I look at this kind of old school way of doing it and I'm like, this is essentially choosing to type on a typewriter as opposed to using a computer nowadays.
Yeah.
Yeah.
Yeah, it's pretty crazy.
All right. Next one.
Let's do it.
Okay, I have not seen these questions. Neither of us have seen these questions yet. These are pulled from online. So let's see what the next one is. Other places say you can get teeth in a day. So what's actually different here?
Okay. I mean, we kind of dived into it. It's a bit of a history lesson again. This is the original techniques of creating an all-on-4 prosthetic that was designed like in the late 90s.
Right.
And so, as you can see, you've got different materials here. You've got the beige acrylic, you got the pink acrylic, you got a metal cylinder, and they all flex at different points.
Totally.
And obviously they don't, there's a transition period between the materials. Very prone to breaking.
Yeah, I would say this isn't like it's not like, flimsy, right? But the kind of movement that we're talking about with it's these micro movements that can really kind of shoot the integration process for the implants themselves, right? Back in my day, pre-Nuvia days, I remember having to repair so many of these. And it was just like half of my time was taken up in the lab in the back, just kind of acrylic and, the molds and all the things. So it is nice to not have to do that anymore.
Yeah, it's pretty crazy.
Of course, the other thing with these is the wait time, right? I mean, these teeth in a day give you a temporary that you are in for several months. I mean, sometimes depending on what was done for the surgery itself, we're looking at 6, 8+ months. With Nuvia, these permanent teeth, 24 hours next day. So yeah, the timeline for the patient improves dramatically, for sure.
Yeah. I think some patients, they look at this, when it first came out, you get that instant gratification. You come in for surgery, you get teeth same day. And they're like, whoa, that's pretty cool. But when you take a deep dive into it, you realize that now you're in this transition period with a repaired denture.
Totally.
For 6 to 8 months. And so it's a tough period. It's a tough transition period before you get to the final.
Totally.
And so it's amazing that, you can take today's technology and make this prosthetic where you're using some of the strongest materials we have in dentistry, and we're giving it to the patient 24 hours after surgery. It's pretty cool.
Yeah, it is. It's pretty revolutionary.
Yeah.
Okay, next question. Doctors online have said our bodies don't heal in 24 hours. Is this safe? What do you think?
Well, of course, I believe our body cannot heal in 24 hours.
Yeah, we're in agreement.
Yeah.
Docs,
we
we're all
agree.
united.
We agree.
Yeah.
You have to respect the body. The body takes time to heal. We're not making this prosthetic fast and unsafe.
Right.
Right. It kind of goes back to your point of micro movements. Would you rather have an acrylic material that's providing stability, or zirconia and some of the strongest materials that we have to create that stability?
It's kind of like a stent, the way I look at it. I mean, through the osseointegration process, that healing process where your body's creating that new bone that grows into the implants cell by cell. In my personal experience, I don't know if you've had the same experience, but I have found that this stronger, more rigid material has actually improved healing in patients and integration. Like I have seen a much lower failure rate in implants since I started with the Nuvia process than I did with the traditional method.
Yeah, I mean, for sure. There's definitely research showing that the failure rate for this, can be between 5-10%.
Yeah.
And, with Nuvia, I think we're less than 1%.
Yeah.
So,
it's pretty cool.
I mean,
totally.
numbers don't lie.
Numbers don't lie. That's right. All right.
So yes, it is safe.
Safe. If permanent teeth in 24 hours is legit, why isn't everybody doing it? This is a good one.
Yeah, I mean, if it was that easy, everybody would be doing it.
Of course.
But it's crazy the amount of hours, time, the large team needed to do this. It's crazy.
Yeah.
I mean, the lab works around the clock, 24 hours.
Totally.
And I know every patient that walks in from consult, that's the beginning of it. We're gathering information, that information being used to create this prosthetic. And so, we have people that are working behind the doors.
Yes.
Making this
team.
possible. It's crazy. It's crazy to, once you get to understand the process, you understand that it's taken years and years of development to create this.
You've been here since right after COVID, right?
Yeah.
With Nuvia. I've been here since 2023. Even in the time that we have been here, like obviously Nuvia had done a lot more R&D even prior to your joining, but the process has continued to fine tune and become better and more efficient. It's not like we've just figured it out and we're done innovating. Nuvia is constantly trying to find ways to make things more efficient and better for the patient using the technology that we have. And so, I think that is quite a unique offering that we have. Does getting this done so quickly mean that the price will be higher? You'd think, right? I mean,
that's what you would think, right?
Yeah.
But it's not the case. It's definitely not the case. Nuvia is definitely below the national average.
Yeah.
And so we're able to create this process. We've developed this process where the savings can be passed on to the patient.
Totally.
So,
I mean, again, personal experience. For just the prosthetic aspect, was charging just as much as we charge for the entire surgery plus prosthetic at Nuvia prior to coming here, like with this. So the fact that patients are getting this for about the same amount that we were charging for that, like just the prosthetic aspect, is pretty cool.
Yeah, and then the chair time.
The chairside time.
For this one is extensive.
It is.
A lot more than this.
Yeah. For sure.
So I think that's obviously where we're getting a lot of the savings, and then we're able to pass it on to the patients.
Yeah. It's a better use of our time and, more importantly, the patient's time.
Yeah.
And the coolest thing, of course, is that Nuvia offers so many different options when it comes to, financials with payment plans and whatnot. They actually put together a cost guide, and it will be available in the description if you want to check it out after this video.
Sounds good.
Cool. Next up, are patients awake or asleep during surgery? How painful is it? Oh, buddy. It's so nice to be able to offer sleepy time for our patients while they're getting this done, for sure.
Yeah, I mean, general anesthesia, it's great. Patients go to sleep. don't feel anything. We have our CRNAs that make sure to take care of the patients, very comfortable during surgery.
Yeah.
I'd say about 90% of the patients, they just need ibuprofen.
Yeah. Like alternating with Tylenol.
Yeah.
Yeah. I've found that too. Like definitely some patients use the like the pain medication that we do prescribe just so that you have it if you need it. But for most patients, I would say it is definitely pretty smooth sailing through the healing. I will add, you know, it is so nice at Nuvia that we have a CRNA as part of our surgical team. A lot of different places will have the surgeon themselves put the patient to sleep, which surgeons are definitely qualified to do, all the extensive training they do at the hospital and everything like that. But, you know, you can ask surgeons, right? Like it's very different putting someone to sleep for 15 minutes while you take out their wisdom teeth to like when you're doing a major surgery on a patient and having to, you know, be very engaged in this surgery for hours and also managing the anesthesia. It's so nice that we can keep the patient very safe with a separate provider also helping to manage that and monitor everything so that the surgeon can focus solely on the surgery.
Yeah. I mean, it's very difficult. I've done it. I've had to provide anesthesia and do the dentistry. And it's a lot because you have to make sure that the patient's comfortable and safe while you're doing the dentistry. Totally. So your eyes are moving from surgery, from the mouth to the vitals. It gets tricky.
It's a long time. I mean, oral surgeons are among, I mean, correct me if I'm wrong, I think the only surgical specialty that is able to do their own anesthesia. Anything else like cardiology or neuro or anything like that, they have a whole anesthesia team there. So, so yeah, it's nice to have the surgeon focus on surgery for sure. Yeah. Are patients prescribed pain medication? Yes. Yes, they are. Yes, they are. Like we mentioned, not everyone needs to take it. It's certainly available for you if you need it. But yeah, again, in my experience, I really haven't seen patients either need to take it to its full extent and very rarely need like any kind of refill or anything like that. I mean, it's typically pretty smooth sailing. It is a major surgery, like you're still recovering. But you know, if you take it easy and ice really well and keep ahead of the pain with the ibuprofen and Tylenol alternating, most patients are in good shape.
Yeah,
is that what you've seen?
I'm good with that.
Is it painful to get permanent teeth the day after surgery? Oh, that's a good question. All right, yeah, I'll take that one. So you leave surgery with little buttons over these connectors that screw into the implants. When you come back the next day, since we do it the next day, or in some very rare cases, like if a patient has surgery on a Friday and they come back on a Monday, the swelling is not peaked when we deliver. And so, you know, in our office, we've found it's very rare. I could probably count on my hand the amount of times that I've had to give anesthetic for the delivery because these teeth are molded or created to what the tissue looks like fresh out of surgery. Yeah. And so, you know, they typically go in quite comfortably. Yeah.
I agree.
Yeah. Is that what you've seen at your practice as well?
Yeah. I mean, patients come in, of course, it's major surgery. So there's a little achiness to it, but the excitement to see the teeth and put the teeth in and then get the reveal, like you said, very rare that you need to provide local anesthesia or anything for the delivery.
Yeah, that delivery is so fun too. Like that's probably one of my favorite parts of being a doctor here is just actually getting to see the patient like turn the mirror around and just see their smile. And if they bring family members or friends, like it's so emotional and just special. Yeah, it's a special time.
It's kind of like the analogy is like kind of like a flower. You have patients that come in for consult and they are so quiet. No personality, they're just a wallflower.
Totally.
And then they get the teeth, they're crying, they're smiling, their real personalities start to come out. And it's just amazing that we can do this in 24 hours.
Yeah. We had a patient, this must have been like 2.5 years ago, who came in for his evaluation visit. And we were all just like trying to, I don't know, talk to him, chat with him, get him to like engage. And one-word answers, wouldn't really show his mouth. And the moment this man got his teeth in, I mean, tears streaming down his face, smiling, so chatty, just like, guys, thank you so much. And it was just like, oh my gosh, your family and friends haven't gotten to know your real personality for how long? Like, this is a real new beginning. So anyways, he sticks out in my mind quite a bit because that was a very impactful one for us. Yeah.
Amazing.
All right, let's see. How long does healing take and when can patients return to work? Healing, I feel like there's multiple layers to that, right? Like you've got your initial gum healing and like the bruising, if you have any, or swelling, that's like a 2-week mark, right? And then the actual implants, if you could speak to that.
So the integration of the implants, they do become weaker at the 2-week mark. And so it's very important that throughout the whole process, you're keeping things as clean as possible. They start to integrate more. And by the 2 to 3, 4 month mark, that's when you're getting some solid bone development around the implants. And that's at that point where we'll come in, we'll take a look, make sure everything looks good. And if you're ready for the next step.
Cool. Yeah, I would say, I would add to that, as far as the initial healing process and returning to work, I think it's job dependent, right? Like if you have someone who is a mover and like taking boxes out of a truck or something like that, I want them to take, you know, at least a week, if not 2, from that kind of strenuous activity. But if you have someone who's kind of like working at a computer or like not really a lot of face-to-face interaction or not on their feet too much, I've seen people return as soon as like a couple of days. Obviously, you know, everyone heals differently. So some patients come in looking like nothing happened and others like with a lot of bruising and swelling. And I go over that with my patients because you got to know what to expect, right? Like everyone's body heals differently and there's a really broad range of normal. So part of it is listening to your body. Part of it is, you know, just giving yourself a chance to heal from this surgery.
Yeah, you just definitely want to take it easy after surgery. It is major surgery, so just take it easy. And hey, if there's a lot of people that work from home, they don't have to take calls.
Totally.
You don't have to talk. That's great. You can return to work immediately, however you feel. Get back on that keyboard.
I was going to say, like, don't be on any of the pain medication when you do that.
Don't make any major decisions.
I don't need you online buying a llama or anything like that. But yeah, you know, use your judgment.
Yeah, common sense. We got it.
Totally. All right. Let's see the next one. Oh yes, this is my favorite question. Like and subscribe.
Tough one.
All right, here you go. Does a gap form once healing is done? Oh man, the gap is my friend. I don't know about you. Let's talk about how and why it forms first and where it is, right? So
mind the gap.
Mind the gap. All right, so fresh out of surgery, swelling, tissues are stitched together. That's how we create these. Tissue over the course of the 4-month period remodels, pulls back. For us, I would say probably 95% of the time, the gap that forms is less than a millimeter. Kind of, I mean, just very small. And that is my ideal for a patient because that way they can floss between it, water pick easily, swish food out of there, and keep it really clean. How do you feel about the gap?
No, I agree. It's very important to keep things clean. And if you got a tiny bit of a gap, it makes it easier to floss, to water pick, to get those bristles in there and brush and kind of stimulate that tissue. And stimulating the tissue will help keep it nice and firm and snug to the prosthetic. And that's like the key. And
so have you had a situation where a patient has come back and the gap that has formed has been like very intense for one reason or another? Like let's say their tissue healed in a weird way or something along those lines.
Yeah, every case is a little bit different, but yeah, you can definitely have cases where you'll have a bigger gap, not a big problem. It's, you know, everybody thinks, oh, you're going to get permanent teeth in 24 hours. They don't do anything about the gap. You know, it's like, wham, bam, thank you, ma'am, done the surgery.
Bye.
No, it's not the case. It's not the case.
Yeah.
You come back in the 4 months and we'll take a look at that gap and we'll add additional material to make sure that it's nice and snug. But yeah, you'll have some cases where, like you said, you'll have like a millimeter gap, and some you'll have like 3 millimeters and stuff like that. It just happens. Every case is a little bit different,
and if it doesn't bother the patient, honestly, like I've had some patients come in where on the lower, let's say they'll have a bit of a larger gap, but they'll be like, no, I don't mind. I can use a proxy brush in there and I'm in a good place. And that's music to my ears. Cause I'm like, if you can keep it clean at home, your annual visits with us are going to be so smooth for sure. No, that is great. Like from what I've seen in personal experience, when the prosthetic is touching the gum or adapted to the gum, it is so much harder to clean. Like those patients, they can't floss, they can't even swish food, liquid between the prosthetic and the gum. So if they're out to eat or something like that, it's a lot more difficult for them to clear any debris that they may have than if they did have the space for it. So sometimes I actually create space for the patient if they can't floss, to be frank.
Yeah, I mean, a lot of our patients are older, so it takes some manual dexterity to be able to clean it. So yeah, those are critical pieces in terms of oral hygiene. So
yeah,
cool.
Love it. How often do dental implants fail?
That's a tough one.
Let's talk national averages first.
Yeah. National average for single implants, implant prosthetics and stuff like that, we're looking at a 5-10% implant failure rate.
And that's personally what I had seen prior to coming to Nuvia.
Yeah, I agree.
With Nuvia, this process, that's why I feel so passionately about this like cross arch stability that this rigid prosthetic provides. We have less than a 1% for failure rate. So over 99% success for these implants. And it's very cool to see. I mean, it's nice to not have to redo work.
Or repair.
My goodness, that's so time consuming. Even if there happens to be any kind of issue, we can typically identify the insulting factor and then come in with like a very simple, straightforward process.
Yeah, we're not going to leave the patient high and dry. We're definitely going to help them out. So.
Totally, yeah. Are they hard to clean compared to regular teeth? Okay, it depends on how we're cleaning the regular teeth. Okay, so regular home care.
Well, if you're not cleaning them,
right, yeah, totally. So normally you're flossing between all of your teeth, as we all are, right? Yes. But so we're flossing, we're brushing. If you have a bridge or an implant or something, you may also be using a water pick. Talk to me about cleaning these.
It's like anything, you need to keep it clean.
Right.
Water picking, all the things that you've mentioned, the water pick is critical. The floss, so you will be flossing underneath. We'll get into it a little bit more. Using a toothbrush, you definitely have to brush it. You want to keep any debris off of the prosthetic and the tissue underneath. You can brush here on the palate, and then we kind of get into super floss.
Right.
Obviously, in the mouth, you're not going to be able to do this.
Right.
But you want to get that.
But that's why that gap is so important, right?
Yeah.
Oh,
wow.
Magic.
Just Amazon Prime.
Hey. So did you order it like 5 minutes ago? Because that was really impressive.
Amazon reads my mind.
Wouldn't that be something?
That's next.
So we've got this kind of super floss. It has a firm end on one end of it. Actually, this one has it on both ends, which is pretty cool. And then this kind of expandable floss. So flossing, as I explain it to my patients, flossing brushes where the brush doesn't reach, right? So it's not just about, we brush and the water picking gets everything. You still have that biofilm, the plaque, the bacteria. So threading it through that gap, this is what we were talking about when we were saying that it's important to be able to clean underneath the prosthetic. If you can thread it through the gap and pull it through, you kind of windshield wiper it between the implants and you repeat that in between each segment. That, honestly, I've seen patients come back now for almost their 3-year follow-up, and patients who are consistently flossing and brushing well, I mean, it's pristine. There's nothing that, in some cases where patients don't do that, we might have to take off the prosthetic and clean it for them and everything. But it is nice, to see when patients really take care of their investment and their health, right?
Yeah.
So yeah, that's
probably one of the biggest, most important hygiene instruments that I recommend.
Something simple, but very useful. And the other thing that I wanted to highlight, we talk about that healing period and how crucial it is. I mean, you think about it, the gums have just been, not to be graphic, but cut open and then stitched back together. This surface underneath being, like a flat, smooth, highly polished surface, I think offers a much more stable environment for the gums themselves to heal. When you have something with so much like different materials, anatomy, porosity, this is a food trap. It attracts plaque. When you look at it microscopically, it's rough. And so, you think about as you're healing, as those tissues are healing, do you really want to have this like pit of bacteria up against the tissues themselves? So yeah, that's another thing that I really appreciate and value about our prosthetic delivery.
Yeah, I mean, with what you mentioned, the porosities and everything, people that wear dentures, you're prone to bacterial infections, fungal
Candidiasis,
infections, fungal. And it's the same thing with the prosthetic like this, acrylic that's porous, but this one, the materials that we use, they're non-reactive, non-porous.
Has anyone had this for years, and how long is it supposed to last? I mean, in an ideal world, right? These are designed to last a lifetime.
Yeah, I mean, that's the hope, right? We want to make sure that these last for the patients the rest of their lives. Obviously, the dentist, all the providers that we can do, we get you halfway there. We provide the clinical work, the prosthetic. The other half is making sure that, you're doing the super floss, the water pick, keeping things as super clean. That's a major part of it.
Yeah. For sure. I mean, I would say almost like most failures that you're going to see are going to happen within that like 4 to 6 month healing period. Definitely within the first year. Like beyond that, something maybe like trauma or, really poor hygiene and home care could contribute to failure. But once the implants are integrated and a part of the bone, like they're a part of you. It's like a hip replacement. Right? That's not just out of the blue gonna fall out of you, I guess. And
I mean, and plus you want to baby these as much as possible.
Totally.
You've spent all this time and money, you've invested in your health. You want to take care of it. You're not going to go out there, start MMA as a hobby.
Right. Well, okay, so that's the thing about this, right? Let's talk trauma after the first year, right? Let's say you do take up MMA as a hobby. You think about the zirconia of the teeth, that ceramic that's as hard as metal. You think about the titanium of the implants themselves. And you think about your bone. Which of those three is the weakest, right? It's the bone. If, heaven forbid, some kind of crazy accident or something like that, it's not like you're going to chip a tooth. It would be like bone problems, right? And so... So the materials themselves are made to last. We just have to make sure that we are protecting, your health, your environment, your oral hygiene as much as possible. Like bite into that apple. Have a great time after the 4 month healing period, obviously. 4 months. But the same way as with natural teeth, any kind of risk or trauma that you may expose yourself to could potentially lead to an injury, right? That same kind of way.
Yeah, use your common sense.
Yeah, common sense is our friend. But if you want to learn more about personal experience with Nuvia's teeth, you can check out Ricky's video. He got his teeth done, I think, back in 2012. 2022.
Yeah, a couple of years, 3 years ago.
Yeah, and he did that video where he kind of went over the good and the bad and what his experience has been. So that would be a great one to check out.
Yeah, I mean, that's going to be invaluable in helping you make a decision.
And if you are interested in learning more about what this could cost you, definitely download the free cost guide in the description below. So until next time,
keep smiling.